Hello, everybody. My name is Zach, and I will be going over Chapter 14 Medical Care Systems Worldwide. A glance into medical care systems worldwide. A comparison done by the World Health Organization, also known as WHO, in 1997 ranked France overall in performance, Japan number one overall in attainment, and the United States number one in responsiveness. Uh, The average growth rate of spending overall in the 1980s was 7.73%, Germany being the lowest at 4.19, and the United States being the highest at 9.78. The average lowered in the 1990s to 5.16%, France being the lowest at 3.82, and the United Kingdom being the highest at 6.8%. The United States has the largest economy measured by GDP, as well as the highest medical care spending in the world. This is both per capita and percentage of GDP. Next slide. This is just going over a couple of the different systems classifications. United Kingdom uses the Beveridge model. France, Germany, Japan, Switzerland use the Bismarck model, and Canada uses a kind of like a hybrid of both. Next slide. Going over Canada, some interesting facts. Canada delivers a higher quality of medical care that can be compared to the United States, covering the entire population of 35.16 million, and is able to do this at slightly over half per capita cost as the United States. Now, I want you to remember that they said a higher quality here. This coverage is also known as a single payer system, in which most of the financing comes from a single source, typically the government. In Canada, this is a fact for moving forward. In 2013, practitioners averaged 135,000 in Canada compared to the U.S. at 195,000. So over here, we make a lot more. Well, the physicians make a lot more. Specialists average 212,000 up there, and the U.S. averaged 284. Next slide. Average wait times. This is a huge issue that they're dealing with, and actually most of the world is dealing with. What I can't believe is up to 58 weeks for cataract surgery. That just seems ridiculous. Lessons to learn from this. Spending and demand inevitably increase when the government provides free service to the consumers. The free system must figure out a system of allocational funds. Everything has a cost. Waiting lists may be viewed as unacceptable and an obstacle to individual decision. This last one, going back to the quality of care, Canada has one of the highest spending out of all the countries with universal health care. Yet it has one of the highest rates for infant mortality, the lowest discharge rates, and the lowest amount of hospital beds. These factors, along with the long wait times, all lead to the population to question the true quality of care. Next slide. France. France attempts to maintain a delicate balance between individual freedom and collective action, solidarity, choice, and competition. The laissez-faire, allow them to do, depicts a situation in which individuals and firms are allowed to pursue their own self-interest without government restraint. This was abolished in 1960 in an effort to moderate spending, and was replaced by state controls over pricing and budgets. Following World War II, the General National Health Insurance was established and covers about 83% of workers. Next slide. Employers pay about 12.8% of employees' salary into the health insurance fund, and employees pay about 75%. Public hospitals are required by law to keep occupancy rates below 95% and remain open 24 hours a day. The same kind of thing for average income for physicians. It's a lot lower. Same with for specialists. Lessons to learn from France. The system imposes global budgets on public hospitals, limits the ability of medical technology, and requires high out-of-pocket spending in the name of cost control. 60% of the population surveyed believe that the system needs to undergo fundamental change or to be completely rebuilt. Next slide. Germany. Germany has sickness funds, a quasi-governmental group that serves as an insurance company by collecting premiums and paying providers within the national healthcare system. All individuals, by law, are required to have health insurance, and those earning less than €49,000 or $65,000 must join one of the sickness funds. Premiums are collected through payroll and average about 15.5% of a worker's gross salary. Next slide. After initiation of cost control measures, the annual rate of growth of spending fell from 12.2% to 5.5% in 2000, so it obviously works decently. Over 17% of the people surveyed gave overall system an A or a B, and almost 60% again think that the system is in need of fundamental change. Lessons to learn from Germany: public health services and psychiatric services are minimal. They're very, very poor over there. They tend to use resources very inefficiently, and providers are divided and specialized without a common information sharing system, leading to problems in gathering and maintaining patient records, more so than what most of the world has. Next slide. Japan. Japan uses a universal health insurance system that is regulated by the Ministry of Health and Welfare and is organized into 3,500 small, independently administrated health insurance societies. Japan has one of the longest life expectancies. That's a good note. Japanese physicians tend to overdiagnose and overmedicate, and patient volume tends to be high. It is not unusual for clinic-based physicians to see 30 to 35 patients an hour. Surgical rates are among the lowest in the world, 1/3 the United States rates, and prescription drugs use is among the highest, 20% of healthcare spending. Next slide. Employee health insurance covers about 51.5% of the population. Mutual aid societies covers governmental workers, 8.6% of the population. The national health insurance covers farmers, retirees, self-employed, and the unemployed, 39.3% of the populations. Lessons to learn from Japan. Quality of care tends to be rather low. Patients use bribery as a way to circumvent waiting lists, and politicians are unwilling to raise taxes, so they squeeze the suppliers instead. More than 3/4 of public hospitals operate as a loss. Next slide. Switzerland. Insurance is sold on an individual basis. Group and family plans do not exist. Second only to the United States, healthcare spending amounted to 11% of GDP and $5,643 per capita in 2011. Permanent residents are subject to an individual mandate to purchase compulsory health insurance, which covers a generous package of medical benefits, including inpatient and outpatient services, unlimited hospital stays, and complementary and alternative medicine. Resource supply is among the highest in Europe. Lessons to learn from Switzerland. With its heavy reliance on private payers, the Swiss system is worth careful consideration as a model for the United States reform. Private companies compete to provide insurance and their subsidies for low-income buyers. Next slide. United Kingdom. In 2010, the average net earning of self-employed general practitioners was 156, so slightly lower than ours, and 110,000 for hospital-based physicians. Over 1% of the population, 750,000 people, are on waiting lists for elective procedures, including cataract surgery, hip replacement, coronary bypass surgery, and breast reconstructive surgery following a mastectomy. About 12% of the population has some supplementary health insurance, largely because of the long wait list for elective surgery. Lessons to learn from United Kingdom. Patients in the UK are among least informed in the developed world, and the culture tends to leave medical decisions to the individual physician and seldom questions medical authorities. Many terminally ill patients have been turned down for treatment in the past. There's a lack of options for those under the healthcare system, and of course, they have long wait times. Next slide. Full summary. As healthcare becomes less and less of an issue and more of a crisis here in the United States, caution needs to be taken when developing our new system. As the U.S. policymakers take the first steps in reforming the U.S. healthcare system, it is important to recognize that no other country has actually solved the healthcare spending problem. There's good aspects from each, and very, very, very poor aspects in the same country. So we need to understand that there's not one would be perfect for us. We maybe have to pick and choose from each country and learn from their mistakes. Next slide. My question for you is, from these countries, which do you think has the best system put in place and why? And then also, what factors make the other countries' systems worse? That's my presentation. Thanks for watching.